Καλησπέρα σας. Έχω την ιδιαίτερη τιμή σήμερα να έχω έναν άνθρωπο ο οποίος έχει υπάρξει στυλοβάτηση στην καριέρα μου. Τον θεωρώ το μεγαλύτερο μου μέντορα. Κάνω αυτά που κάνω λόγω αυτού του ανθρώπου που βλέπετε εδώ. Δεν θα πω παραπάνω, γιατί θα χαλάσω όλο αυτό θα τον αφήσω να μιλήσει μόνος του και θα καταλάβετε για ποιο λόγο δεν μπορώ να περιορίσω με λέξεις όλο αυτό την υπεροχή που έχει αυτός ο άνθρωπος, τόσο σαν επιστήμονας αλλά και σαν προσωπικότητα. Δόκτωρ Φραντζή, καλησπέρα.
Γεια σου, Ρόκο.
Χαίρομαι πάρα πολύ που είσαι εδώ μαζί μας και που θα σε έχουμε 22-23 Μαρτίου στην Ελλάδα για πρώτη φορά να μας μεταδώσεις τη σοφία σου, την εμπειρία σου στον χώρο της υγείας, της βελτιστοποίησης της υγείας. Και όχι μόνο, περιμένουμε πάρα πολλά πράγματα όπως έχουμε συζητήσει ότι θα γίνουν. So, welcome home in a way.
Thanks, Rocco. I'm really excited to be here with you, and I'm very excited to come to Greece in March to be with you guys there and have a fun weekend learning and sharing a lot of experience and stuff.
For me, it's a great honor. We've known each other for more than 25 years, and you've been the quintessence, if I can say, of my stability as a young scientist and as a person as well. And it's the least I can say about what you've been there for me for all my steps, all my baby steps as well.
Well, we've kind of grown up together, and it's been great to be there with you all the way, and I look forward to more on the journey.
For sure, for sure. For the people that don't know who you are, can you just give us a kind of a brief bio on that?
My name is Dr. Emmanuel Frantzis. I'm a chiropractor, a manual osteopath, a functional medicine practitioner, and a diplomate of the American Chiropractic Neurology Board, so a functional neurologist. So I combine all of that stuff into my practice in a, I guess what I would say is a very unique approach to the treatment of, dis-ease and helping people to recover and come back to wellness and their journey of healing. So I combine manual therapies with exercise and advanced approaches to exercise, with the functional medicine approach and the functional neurology approach all mixed in. I'm now in my 30th year of practice. I can hardly believe I'm saying that. I've been blessed with a very wonderful kind of career, a lot of great experiences. I was the national team therapist for Canada's national beach volleyball program for about 12 years. Went to 2 Olympics with them. One of them was in Athens in 2004 and in Sydney in 2000. I've had experience working with NBA, with the Toronto Raptors as a special consultant for a few years, working with NHL athletes, worked with, high-level athletes across the board in national sports from, name it, from rowing to track to swimming, all across the board. I have a private practice.
You still do?
I still do, yeah. Mostly these days with hockey players, but I still have involvement with a number of national level athletes. And I'm in private practice here in Toronto and doing some teaching. That's basically me in a nutshell.
Thank you for narrowing it down. I've uploaded your CV for people that need to know more. There are also a lot of videos of you teaching. And I know you teach in the States more often, and I'm so glad that we're going to be having you in Europe more often for your teachings. For people that don't understand, can you explain what functional means when we talk about the functionality of functional neurology and functional medicine? So people can understand.
It's funny. This word functional has crept into everything now. It seems to be a catchphrase, but for me, the word functional really boils down to some of the philosophies that stem from osteopathy as the starting point, which is addressing a problem by trying to get right back to the root causes of it, and treat that person as a whole being. So the whole mind, body, spirit approach of treating that person and whatever condition they're approaching us with. So we're not just treating somebody with neck pain or back pain or a concussion or whatever the case may be. We are really addressing the entirety of that person and all of the factors that are going into affecting what their condition is. It may be a lot more than just back pain, or sciatic pain, or whatever the case may be. So again, it really boils down to looking at the root causes and treating that whole person and understanding the basic premises of that stem back, like I said, to osteopathy and even to chiropractic, where structure governs function. And if there is a breakdown somewhere in the physiology, in the mechanics, then the person will have some complaint, whatever that might be in the end.
Well, one of the parts of your success was Descartes' error, when he kind of splitted the body away from the mind, and Damasio came over and said, well, that was Descartes' error, and you've been saying that for 30 days. We never kind of, if we try to fix where the pain, where we think the pain is, we failed. And I've worked with you. I was blessed to work with you and still do. And you've got a unique way of kind of translating what's going on in the body. And it's more important that you want to share that knowledge. And I've seen that you do with your students, and it's incredible. It's not easy, but it's incredible. It's simple, but you simplify it in a way, but you need to know the ground rules of how everything functions.
Yeah, ultimately, what I try to do and what I try to impart with people that come to study with me is that we really need to be able to understand the whole being. And that means, as I'm talking to any individual patient, we're jumping from anatomy and biomechanics to physiology to neurology, and we're often going back and forth to explain what is happening. And so, sure, someone might have a biomechanical issue, or we can call it that, but what effect is the nervous system having on that? And what effect is that having on the nervous system? And what effect is that going to have coming out to affect physiological functions? And as we change the function of the brain, for example, how we change metabolic issues, and how we have a whole cascade of events that stems from that.
In Saturday, March 22nd, and then Sunday, March 23rd, we're going to be mastering lumbar and pelvic treatment. And as you said eloquently, it's going to be a deep dive into biomechanics, neurology, and manual therapy. What should people expect on the day?
Well, what are we going to expect? It's going to be an intense weekend. We're going to cover a lot of material. We're going to cover a lot of ground. And I'm going to start to introduce people to the approach via the lumbar spine and pelvis of understanding and integrating a real integrated approach of manual therapies and understanding biomechanics and the interplay of neurology with mechanics, and then how that starts to affect metabolic function, and then how we intervene, and more importantly, how we figure out where we need to intervene and where we don't need to intervene. Because one of the important things in treatment is, what do I need to do and what do I need to avoid doing? And I think people make a lot of mistakes because they don't understand what to leave alone and where they actually need to intervene to make the desired change. And that's why people are spinning the wheels. They'll feel better for a couple of days, everything will return, and they don't progress and actually kind of heal.
Can you give us an example of that?
Well, based on this weekend, for example, is chronic back pain. You understand in the literature the outcomes for chronic back pain are very poor. And why is this? And we're gonna study what is actually happening, what is being missed, and where do we need to approach to change that so that you're not falling into that category of another failed treatment.
We've spoken about that numerous times, and I know you've worked with and you've done research with Stu McGill,
Yep.
and that's what he always says is we're playing jazz, and that's the biomechanical part, and that's why I respect him so much, because it's kind of, he knows when to stop and where to kind of focus. And then he always says about the nervous system that a lot of people in the industry, especially in biomechanics, forget about that. Do you agree?
100%. And I love how he said that we're playing jazz, because really what that boils down to is there's an art to it. There's an art and a science. And so, of course, we rely on evidence-based approaches, but there is also an art within that, and the science is unfortunately not complete. We haven't done all the research we need to do. We don't understand everything we need to understand, and we have a lot of research that doesn't get considered when people are talking about rehabbing low back pain, for example, in biomechanics. And it's nice to see that Stu is talking about that, because a great example is someone with an issue affecting their cerebellum, and now they've got aberrant output or control, because of course the cerebellum doesn't directly fire to any muscles. It's reflexively affecting tone, and so you have aberrant tone, and so you have unequal tone left to right. So someone comes in and says, well, here's your L3, L4, and they're rotated to one side, and we've got to fix that. But you don't understand that they're like that as a consequence of this aberrancy of tone, as a result of failed inhibitory mechanisms or output mechanisms coming from the cerebellum. And so if we don't understand how to recognize that and then address it so that we normalize that output, and we now have proper tone going to both sides of the spine, so that now the spine stands a chance at actually functioning the way that it should and the way that we want it to.
So we're going into circles because we're just focusing on the outcome, right? Because would you agree? I have a lot of people coming to me and it's like, oh, I feel really tight, and I went to a practitioner and told me to stretch this out, and we all know that, or we don't, that's like kind of a defense mechanism to create, let's say, stability at that joint, but that stability comes from higher up, which the captain of all is your brain.
Yeah, absolutely. I mean, and again, part of what we're going to do on this weekend course is we're going to understand, when is it coming from the brain? When is it coming from a muscle imbalance because you trained inappropriately? Maybe you're a tennis player who just continually does a stroke in one direction with one hand, and you develop this imbalance, and nobody ever properly coached you and to correct that and restore balance in you. And so these problems keep coming back, or any number of cases where people have created imbalance in themselves. How is the practitioner going to recognize what's what? And this is one of the things we're going to deep dive into, is differential diagnosis of, well, no, you just trained yourself into this problem, or your mechanics are you have poor postures or poor movement patterns that have created this problem, or you have a neurological issue that's causing this problem, or you have, secondary to, say, a vestibular problem, or you have a metabolic condition that's affecting cerebellar output, which is affecting muscle tone to your spine. Now you have an imbalance. And that's one of the things that we're going to help people to differentiate, so that they can come in and solve that problem for the person and fix it. So
you said posture, and there are a lot of people out there that say that posture doesn't actually play a role. What's your take on that?
Well, I think that's a little bit of nonsense. I mean, we understand, if we take it back to a biomechanical model, we understand that physics exists, physics is real, gravity is real. And if I change the lever arms and the fulcrums on the spine, there is a wear and tear consequence. And over time, that will result in breakdown of tissues. If you have non-contractile elements that are bearing abnormal loads for extended periods of time, you will induce breakdown. You will induce breakdown of disc elements. You will change the function of joints, which will cause breakdown of those. And that will be one mechanism of finding yourself in a chronic pain scenario.
Would you agree, like in a Camp-to-Cormick kind of posture, does that come first? Is that like a sign that there's things coming up? Does posture, like kind of dysfunction, comes first, or vice versa? That's killing me.
I mean, posture is a complicated discussion, right? And that's a conversation that in and of itself would make a fascinating discussion for a good amount of time, because there are reflexive elements. You know, of course, camptocormia is secondary to frontal lobe demise. And so we can see that surprisingly early starting in people. And so you can see early Parkinsonian signs. It's not uncommon to see it in people's 30s, where they're already starting to show these features. But then there's the habitual element, where someone just hangs out on their computer, or they're playing video games, or they're playing guitar or piano, and they're just assuming these postures as a habit. But neuroplasticity dictates that will become now a set pattern. And if that's what you want, that's what your brain will wire. And you repeatedly do it. And so you create a vicious cycle. Where does the vicious cycle begin? It depends. You can have a brain injury that starts it. You can have a bad habit that starts it.
Or inflammatory kind of cascaded events of your brain.
Exactly. A number of metabolic conditions will start to come in and start these processes as well. And again, this is what we're going to start to study. And how do we recognize these things? And how do we differentiate them in order to make the appropriate intervention to actually make the difference and not be one of those statistics of another poor back pain outcome?
That was my thing, because we've got a lot of people that say repeat Frost's form follows function. And a lot of people get tangled up on that because, yes, up to a point, it's true. But by just saying that, you're missing kind of the forest many times.
Yeah, I exactly. You hit it exactly right. It's a vicious cycle. And the thing about vicious cycles, it can start on either end of the cycle. And so, the posture is just one example of that. It's not a one-way street. It goes around and around. And like I said, it can start from a bad habit and create plasticity that creates this, and then on you go with a whole number of consequences. Or it can start from the brain for a number of reasons, whether it's a direct brain insult or a metabolic issue, and you started the cycle from there.
We kind of spoke about the biomechanical aspect. You guided us through the neurological aspect, but then you say all this can interact with the biochemical aspect of the individual. Can you guide us what we're expecting to learn about that in that weekend?
Well, yeah, I mean, we're going to start to introduce the concepts of, number one, assessing and having the ability to have the tools so that you have the ability to differentially diagnose where is this problem stemming from? Is this a mechanical issue? Did it start from mechanics? Did it start from a neurological issue that's affecting muscular function, that's affecting mechanics as a secondary consequence? Is this a metabolic condition? And we're gonna discuss all the physiological and pathophysiological mechanisms. Obviously not all of them in 2 days, but we're going to start to introduce these things. And we are planning on following up with a cervical spine and head curriculum.
That's where I was getting at. Yeah.
In order to further delve into these things. And then, there will be advanced modules where people continue to understand and learn more about how these things work, because there's a lot of material that needs to be covered.
What are you going to cover in this weekend, that's going to be more kind of a philosophical kind of conversation now, meaning that you've been in the industry for 30 years. Let's say you're going back 30 years with the knowledge that you've got now. Because I want to, you know what I mean? Like, I'm trying to, there are a lot of people that called me up and is like, who's this guy? And I said, it's hard to kind of translate what you do. And I said, well, after that Sunday, you're going to be better. Like you're going to be mind blown. And what would you like? It's like, 30 years, you're coming in for a weekend. I know you're going to cut all the crap and you're just going to delve into reality, an actual application of what people can do on leaving on the Sunday. Monday morning, they go to their practice and boom, they start getting results.
Yeah, that's exactly what my intention is that Monday morning, they're going to be an entirely different practitioner that is, basically changing the game where they live. And, you now become the go-to person in your area because you're understanding things at a level that other people aren't understanding. And you're going to get the results that other people aren't getting. And immediately patients are going to know that there's something different going on and you're understanding things at a level that's far beyond what the average practitioner is understanding. And you're making changes in a way that the average practitioner is not making. We're going to go far beyond, again, I'm bringing together 30 years of experience and an integration of a number of different practices. The one thing I didn't mention is the very first thing that I started was I was an athletic therapist. And I often don't bring that up, although I probably should bring that up because it does add a big element to understand a lot of the conventional physio-type therapy strategies. Not only understanding the strategies, understanding their literature, understanding their real life clinical outcomes and what you can expect from that. And of course, there are some positives that to be taken from that I've integrated into, what I think is pulling out the best of chiropractic, pulling out the best of osteopathic manual practice, plus functional medicine, plus functional neurology, and integrating that into a unique approach that is truly integrative, where, it's not like you're just getting the one approach where I'm a chiropractor or I'm an osteopath, and so you're getting, distilling some form of chiropractic or some cookbook method from osteopathy or something of that nature. It's truly, as Stu put it, the jazz, the art of it, where we're going to introduce you to the art of dancing between biomechanics, neurology, physiology, understanding metabolic function. How does the brain function affect metabolic function, and vice versa, the metabolic affect the brain, which affects the way that the spine moves. How does a problem in your spine affect how your brain is working, which is now going to change cerebellar, vestibular, frontal, even parietal mechanisms coming out. How is that going to impact as we get into the cervical spine and head portion? How is that going to change their eye movements, which is going to further impact cerebellar function, which is going to change output into their neck, their back, how they react to everything in the world, how they react to moving objects, their ability to perform in athletics, their ability to perform daily tasks like being a passenger in the car and being able to read your phone when you're in the car. Go ahead and ask how many people can't read their phone when they're in the car, right?
So many.
And do you
100%.
understand why you can't do that? And do you understand that relates to your back pain and that relates to your neck pain and that relates to that your gut doesn't work the way that it should? And how do we fix that? This is what we're going to be starting to introduce people to and take them down this road.
Dr. Frantzis, I'm so looking forward to that weekend.
Well, I'm excited. I'm Greek, of course, as you know, and I'm super excited to come to Greece. I've wanted to do this a long time, and I'm very pumped that we're finally making it happen.
Σε περιμένουμε 22-23 Μαρτίου το 2025 με μεγάλη χαρά.
Looking forward to being there.
Ευχαριστούμε πολύ.
Παρακαλώ. My pleasure.